Most other sites have dropped for at least a week. Most are down sharply or are fluctuating at levels well below their BA.1 peaks. Edmonton and Lethbridge in particular are down to a fraction of their BA.1 peaks. Edmonton has been dropping for 2 weeks at levels well below their BA.1 peaks. Edmonton and Lethbridge in particular are down to a fraction of their BA.1 peaks. Edmonton has been dropping for 2 weeks from a recent peak, April 18th, to the latest update for May the 2nd. Lethbridge has dropped for a week from its recent peak of April the 20th. This is good news, but let's be clear what it means and what it does not mean. It looks like we're passing the peak of BA.2 circulation with less impact than we saw with BA.1 thanks to vaccine and prior exposure. But hospital admissions are still rising, and they'll continue to rise for a few more weeks, even assuming virus levels continue to decline. Over the past week, we've seen another small increase in COVID-positive patients in hospitals, while the number in intensive care has remained about the same for the past month. Our data is in line with what we're seeing in other provinces. It looks like BA.2 has peaked in Quebec and Ontario, as both provinces are recording declining rates of transmissions and new cases. In BC, they're continuing to see a rise in new cases and admissions to hospital, but it's much slower than compared to the BA.1 wave that we had late last year. So it's becoming clear that we and other provinces are seeing less impact from BA.2. That's in line with what we expected, and we hope it will be the pattern with future waves. But we don't know that. Future variants could have more impact. So we need to plan for future waves and press ahead with the work underway to add capacity. And we're doing that right across the system, from EMS to surgery to continuing care. And the reality is our hospitals and the system overall remains under significant stress. We're seeing the equivalent of yet another winter peak in patient volumes, especially in EMS and in emergency departments. The numbers overall remain in line with past years, but occupancy at a few large sites is well over 100%. And while some periods of very high occupancy are normal, this is not a normal year after 2 years of COVID-19. The staff are under real strain, and we owe them a tremendous debt of gratitude. I hope and expect they'll start to see some relief soon as the level of virus drops. And once again, to all of them, I would like to say thank you. Once the levels drop, that will mean fewer patients needing admission, as well as fewer blocked beds due to infection control measures and fewer staff off sick or in isolation. The healthcare workforce has been strained by the pandemic in Alberta and in every province, and we need to build it up. So we are doing that, adding nurses, paramedics, and other staff as fast as we can recruit them. We need to live with COVID at the same time that we manage all the other pressures on the system. And the key to living with COVID is getting more people vaccinated. We're grateful to each and every Albertan who has been vaccinated with all the doses they are eligible for. At the same time, we're continuing to use any tool available to protect people and reduce the strain on our hospitals. One of those tools is the antiviral drug Paxlovid. As I mentioned last week, we've been working to transition the prescribing process to family physicians and other primary care providers. Today, I am pleased to announce 2 changes. First, starting today, Albertans who meet the clinical criteria for Paxlovid can be assessed for treatment and obtain a prescription directly from a physician, nurse practitioner, or pharmacist. This change will make it faster and easier to access the drug and begin treatment, which must be started within 5 days of the onset of symptoms. That said, prescribers are still getting the tools and supports they need to make sure they're comfortable prescribing Paxlovid, so we don't expect that all service providers will start this right away. Eligible Albertans can still call AHS if that's more convenient, or if their primary care practitioner is not prescribing at this time, or they don't have a family physician or can't get in to see one right away. We're also making the testing requirements more flexible. As you know, up until now, eligible individuals have needed a positive COVID-19 test result in order to get a prescription. Effective immediately, a positive rapid test result will be accepted as well. It can be a test done at home and then confirmed by a prescriber, or one that a prescriber administers in their own clinic. Which type of test and where it's administered will be at the discretion of the prescriber. Albertans at high risk of severe outcomes who know or suspect they're positive for COVID-19 should call their physician, nurse practitioner, or pharmacist to determine if they're eligible for treatment, the testing requirements, and whether prescribing is offered. We're making these changes to help more Albertans access Paxlovid. But a reminder, the clinical criteria are based on expert judgment of the risks and benefits of the drug. They're based on the evidence, and those criteria remain in place. Primary care providers can align COVID-19 treatments with their patients' health status and goals and serve them in their own communities. To date, more than 1,700 prescriptions for Paxlovid have been written. We have more than 29,000 courses of treatment in stock, so don't hesitate to pursue this treatment option if you or someone you know may be eligible. Call your physician's office, pharmacy, or HealthLink as soon as symptoms develop. As I've said before, while Paxlovid can help, it's not a replacement for vaccination. If you haven't yet received every dose you're eligible for, please do not wait. Once again, thank you for doing everything that you do, and thanks again to all of our healthcare workforce for stepping up during these challenging times. And with that, I now invite Dr. Hinshaw to give her update.
Thank you, Minister, and good afternoon, everyone. While our efforts have largely been focused on COVID-19 in the past few years, my team continues to work on other issues impacting the health of Albertans. So I would like to start today by talking briefly about avian influenza and human health implications. Avian influenza is a disease that occurs naturally among wild aquatic birds, and it can spread to domestic poultry as well as other birds and animals. Currently, there are several farms in Alberta with the virus in their flocks, and some wild birds in the province in whom the virus has been found. Our colleagues at Alberta Agriculture and Alberta Environment are working closely with the Canadian Food Inspection Agency to manage the animal health implications. But I know Albertans involved with these farms or living in these communities may have questions on what this means for their personal health. What is most important to know is that there have been no cases in people in Alberta, and it is very rare for people to be infected with avian influenza. There is currently one case under investigation in the United States. However, this involves an individual who had very close contact with infected poultry. This week, Alberta Health Services public health nurses will be calling impacted farmers to discuss human health implications and ways to keep their families, workers, and other people on the farms healthy. We've also received questions on whether it is safe to consume poultry or poultry products such as eggs, particularly from hunters or individuals with small backyard flocks. This food is safe to eat if properly cooked. Avian influenza virus is destroyed at the temperatures required to cook meat or eggs, as would routinely be done. I encourage Albertans to visit alberta.ca if they have any other questions about avian influenza. Alberta Health has information related to public health, and both agriculture and environment have information related to animal health available. For anyone with a small backyard poultry flock, if you have not already signed up with Alberta Agriculture to receive information that may be relevant to you and your flock, you can do so on their website. A more common risk that I also want to highlight today is seasonal influenza. We are experiencing a rise in seasonal influenza with levels higher than they have been at any time in the past 2 years. In Alberta, we have had more than 700 cases diagnosed this season, with the vast majority identified in the past 2 months. Of these, 68 people have needed hospital care, and 3 have needed care in the ICU. Actions to lower the risk of influenza infection are the same as those we need to continue for COVID: washing our hands regularly, staying home if sick, and for those at higher risk of severe outcomes, considering actions like wearing masks when in public places. Turning to today's COVID-19 update. Between Tuesday, April 26th and Monday, May 2nd, our PCR test positivity ranged from 21 to 27.3%, with an average of 23% for the week. This is a slight decrease from the previous week. As the Minister mentioned, hospitalizations have increased slightly from last week, and currently there are 1,267 people with COVID in hospital, including 46 in the ICU. Sadly, between April 26th and May 2nd, 69 deaths related to COVID-19 were reported to Alberta Health, with an average of approximately 10 per day. The individuals whose deaths were reported over the past week were between the ages of 28 and 102. My thoughts are with every Albertan grieving the loss of someone they cared about, no matter the cause. Whether we're grieving the loss of a loved one, experiencing illness ourselves, or adjusting to a transition to a more normal life, the last few years have taken a toll on all of us. So as this week is Mental Health Week, I would like to recognize the complex emotions many of us are feeling right now, and the fact that Albertans continue to wrestle with the effects of this pandemic in many ways. Depression and anxiety in us or those we care about are just some of the ways these impacts can show up. If you or someone you know is having these struggles, or if dealing with stress or uncertainty feels overwhelming or is interfering with daily life, I urge you to seek support. Free, non-judgmental help is available for anyone who needs it. A list of comprehensive resources is available at alberta.ca/mentalhealth. Albertans can also call 211 anytime, day or night, for mental health support. And no matter what you're struggling with, I want you to know you are not alone. It takes courage to reach out for help, and that help is there for you. I'd like to end today by encouraging each of us to find ways this week to employ compassion, both for ourselves and those around us. That could include practicing self-care strategies such as exercise, eating well, or using mindfulness techniques. It could also mean reaching out to a loved one or someone in the community to see how they're doing. We need each other, as we always have, and making time to show we care can have positive impacts far beyond a single moment. There are a lot of challenges that face us, and all of them are easier to manage when we work on them together. Thank you, and we're happy to take questions.
Thanks, Dr. Hinshaw and Minister. Looks like just two reporters in the queue on the phone and no one here in the room, so we'll take the first caller, please, operator.
Adam Toy, Global.
Yes, thanks for taking my question. We saw this week lineups out of the Alberta Children's Hospital Emergency Department doors in Calgary here this week. HS, we're still waiting for a response from them, but a question for the Health Minister, wondering if you're aware of this, if you're aware of anything that might be behind this, for example, any sort of staffing issues at ACH, and if so, what's being done to address it?
So thanks for the question. So I'm not aware of any staffing issues. The initial report that I got back, there is no staffing issues currently. The volumes are high. I had an opportunity to tour the Royal Alex earlier this week, and and have this conversation about volumes and what's driving it, and it's a combination of factors. One of the factors is associated with COVID, BA.2, obviously, but as mentioned by Dr. Hinshaw, the flu is impacting it, and there's also higher levels of acuity. One of the things that doctors were commenting and that they're seeing is that individuals who, during the 2 years of COVID previously did not see as much in terms of the primary care, so they're presenting to the hospital with higher levels of acuity. So all of these things are driving sort of higher volumes right at this point in time, and the solution, quite frankly, for that is increasing capacity. As I mentioned earlier today, we're doing that. That's going to take time, but I do want to thank, again, all of our healthcare providers for the tremendous work that they're doing in terms of managing through this volume. Very hopeful that, we're seeing signs of, declining in terms of community spread. We'll still see increased pressure on our system over the next few weeks as it works its way through, but then to be able to come back, and then we can focus on adding more capacity for future rounds, and you'll see that pressure come down.
Thanks, Minister. Adam, a follow-up?
Yes, a question for Dr. Hinshaw. A Children's Hospital ER doc we spoke with says the flu and COVID are both peaking at the same time. What can be done about this? Should kids be wearing masks? Can there be an increased push for vaccinations?
We know that the influenza A virus that's currently circulating is one that's not ideally matched to the vaccine that was used this season. So when that happens, while vaccine can still help somewhat, we know that in the past, the effectiveness of influenza vaccine kind of ranges year to year. What I would say with respect to the things that are most important to manage or lower the risk for both influenza and COVID, whether it's for kids or people of any other age, is, again, making sure that hands are washed regularly. Certainly masks are an important intervention, and especially for those who have risk factors. Wearing masks in public places is an important consideration. Also making sure that we continue to normalize in all of our circles the important habit of staying home when sick. So trying to avoid being around people who have a respiratory illness, and making sure that we're supporting those who need perhaps a little bit of time if they're feeling sick to not be in close proximity to others. So those are really the key things. Obviously, COVID vaccination is highly effective at preventing severe outcomes. So that's an important intervention for children who are old enough to receive that. And for younger children, again, it really is about those other key preventive measures that people can take every day.
Thanks, Dr. Hinshaw. We'll go to the next caller, please.
Terry, CTV.
Hi there. I just have a quick question about the situation in Calgary in terms of the wastewater to the minister or Dr. Hinshaw. I know that we're saying in other areas it's declining. What is the situation like in Calgary? Is it, staying the same or increasing? And just what kind of concerning levels are those at? Any kind of reminders to Calgarians or anything of that note?
I'll maybe start, and then if the minister wants to add, that would be great. So we are seeing, we have seen throughout the last month or so higher levels in Calgary with respect to virus and wastewater. We know that that's a marker of transmission in the community that doesn't rely on test-seeking behaviors. But we are, again, seeing that in most other places in the province, that decline from a previous peak. We expect that in Calgary, we would start to see that as well. We know our other leading indicator of test positivity is beginning to decline. And so ultimately, I think the important thing for Albertans to be able to do when they're wondering about risk in their own community is to look at the information that's available on the Alberta Health website, where they can see multiple indicators, including the cases that have been diagnosed in the last week in their geographic area. They can see the positivity rates in different zones, and they can see the wastewater results for different cities where that's being tracked, and use that as a measure of what the risk might be in those communities to inform the decisions that they make about their daily activities.
Thanks, Dr. Hinshaw. Terry, follow-up?
Yeah, just on that note, I should have asked at the beginning, but is there any indication why Calgary's kind of bucking the trend?
It's really difficult to say. One of the things that's important to remember about wastewater, again, is that the absolute level is difficult to compare from one city to another just because there's some different sampling techniques. So while we're working on variation, reducing variation across the province, what is most important is to look at the trends in any given area. So it's really difficult to say why Calgary might be a little bit different, why they might not be coming down as quickly as other places. But ultimately, whatever the reasons for that change or the difference in the trend, again, the important thing is to use that as one of several metrics when people are looking at what their risks might be in their community to inform those protective actions that they take.
Thanks, Dr. Hinshaw. We started with two, but I think one more joined. So, operator, we'll take a third call and then stop there.
Laura Beamish, Fort Mac Today.
Thank you so much for taking my question, Minister Copping. It's unrelated to COVID, but back in 2018, it was reported the NDP government was discussing expanding abortion services to Fort McMurray, Lethbridge, Medicine Hat, Grand Prairie, and Red Deer. Obviously, COVID-19 has had a great impact since then, but is pursuing this a priority?
So my understanding when my predecessor was asked the same question and looked into that is that, even though the previous government may have spoken to that issue, AHS is the one that makes the decisions of what services will be provided and where based on the demand. And they had no plans to be able to to increase the current level of service that abortions are provided. And as you know, abortions are provided in there's clinics in Calgary and Edmonton. My understanding is AHS has no current plans to expand that, but there also is other options associated with mifogimiso, which is an oral-based option that is available across the province.
Thanks, Minister. Laura, a follow-up?
Yeah, thank you. Minister Copping, just when you're looking at expanding and increasing more healthcare support in rural areas, isn't abortion services something that you're talking about or looking at?
So again, AHS is, when we look at services generally, you look at the demand and the requirement, and AHS looks at that with the demand where it's needed, and they do that not with just abortion, they do that with all services. Transfusion services, for example, cardiac services. So there is an assessment that they actually go through. One of our focuses in the challenges that we're having right now is about ensuring that we have the staff in rural Alberta to be able to deliver the services that AHS has already determined that should be delivered, given the demographics and the demand in those locations. And so we are focused on increasing staff, recruitment and retention of doctors and other healthcare professionals in rural Alberta to be able to deliver those services that have already been determined that are required given the demographics and given the demand.
Thanks, Minister, and thanks, Dr. Hinshaw. We'll stop there and see you back here next week for the next update.
Thank you.